realized that one of the biggest challenges that we have as an organization, but also as a healthcare, is that access to patients and really understand what the challenges they face within their treatments, which is outside what we normally capture in terms of the one-to-one interactions with the nurses. And that's how we start thinking about the CareTranscribe. Essentially what it is giving us the opportunity to get those insights that normally we wouldn't have access to, and then get that data in a structured way that can help us to identify trends and therefore use that data to generate new type of services that help those patients to stay on treatment longer.
So what is ambient clinical AI? Well, really it's in some ways it's technology that takes away technology. So if you think of a traditional consultation experience with a doctor or with a nurse, often they might be focused on the computer and not be focused as much as possible on the patient. And this technology allows them to focus fundamentally on that clinical consultation and to take away also the clinical documentation that can take up to a third of a working week for a typical nurse or doctor.
In terms of the actual output of CareTranscribe, I think if you think about the work that the nurses do, this hopefully will actually take away some of the admin that the nurses need to do and fundamentally giving them more time with the patients, which is actually where they should be spending their times. From the patient's perspective, this is great because instead of having someone in front of you who's actually focused on the tasks of capturing certain information and going through the admin, is dedicating time to you as a unique person, your unique needs, and actually can open up more about where you are in terms of the treatments, how you're feeling, and actually help that nurse to better understand what they can do to help you go through the treatment better.
One of the things we talk about at Microsoft is the journey to becoming a frontier firm. And in fact, we're on that journey ourselves. And by that we mean an organization where AI and technology really is at the heart of what we do. And we see that in so many expressions of the partnership with yourself. So whether it's the work that we've done on AI transcriptions, for instance, or more recently, the pilot on Dragon Copilot, so ambient AI scribing for nurses. I think there are so many ways in which our partnership is starting to show what can really be done at the leading edge of healthcare and technology.
I'm also very pleased because if you think the relatively short period of time that we've been working together and the fact that we put together a pilot that we can have it up and running within 4 or 5 months, and such an exciting prospect in terms of where this will take us. But for doing that, we really need a partner where we work together in this intersection, if you like, between patients, healthcare and technology. So yeah, very much looking forward to future developments.